Ashley Bach is a member of the Mishkagogumang First Nation and was born into foster care in Vancouver, British Columbia. She first started advocating because she didn't want her foster siblings to go through the same systems she had. Ashley has produced meaningful youth and care-led research, developed impactful programs, and provided policy recommendations to evaluate and help transform child welfare legislation, policies, and programs, including Bill C-92, an act to respect First Nations, Métis, and Inuit children, youth, and families. Through her work, Ashley has made an extraordinary difference in the lives of youth in care.
My fondest memory so far is of the very first national gathering of First Nations youth in care, which happened in October 2019. Getting to meet everyone and see the incredible advocacy they're doing gives me hope, and I know their voices are being heard.
Nicole Bonney has dedicated her professional life to creating sustainable change at the systemic level in child welfare. When Nicole first started working with children and youth in the child welfare system, she observed the overrepresentation of Black children, youth, and families. This led her to want to understand more about anti-Black racism in the system and gave her a passion to support those who are on the margin. In 2019, she was named the first Black CEO in the history of Ontario Association of Children's Aid Societies and in the province's child welfare sector. She has made and continues to make a positive impact on the lives of children, youth, and families in the Ontario child welfare system.
The most profound moment that I have had while working with children and youth in the child welfare system happened very early on and actually motivated me to do the work that I do. There was a documentary that I had supported, and this was to get the youth a voice, particularly Black youth voice, in talking about their experience of being in the system. And what we heard them say was they identified things like not having their needs met through hair care or skin care, but they also identified larger systemic issues around being criminalized in group homes, being treated unfairly, not being heard or listened to, and feeling invisible.
Dylan Cohen is a Jewish and Red River Métis organizer, advocate, and former youth in care from Manitoba. Growing up in care, Dylan knew that the system he experienced wasn't fair and that it could be changed. Before aging out, he founded a Manitoba campaign called 25, Not 21, to challenge child welfare policymakers. Soon after, Dylan moved to Vancouver and became the Fostering Change Initiative's campaign organizer. Dylan successfully shifted the Fostering Change Initiative from the project of a large community foundation to a grassroots, youth-led political and capacity training campaign to support young people leaving care. Dylan's vision and work is felt across BC and Canada, and he continues to push for change in the child welfare system.
My most profound moment was easily the Policy Solutions Day event that we put on every year, where I brought 50 plus young people to Victoria to meet with decision makers and ultimately address the Premier and dozens of cabinet ministers and MLAs and all of these party officials and government officials to speak truth to power and to show young people that their voices can affect systems and that we can get media and the public's attention on it.
Julie DePatie's commitment to supporting permanency for children and youth in families grew from her own adoption journey. Julie always knew that her children would define her purpose and redirect her voice for change. In forming Adopt for Life, Ontario's Association for Kin, Customary Care, and Adoptive Parents and Caregivers, she created a unified voice and invaluable peer network for adoptive parents and permanent caregivers. A changemaker at heart, Julie has helped shape legislation designed to strengthen the child welfare system to better protect some of Ontario's most vulnerable young people. Julie has been a passionate advocate in the nonprofit sector for more than 20 years.
when our son came to us at the age of 8 years old, he was struggling with his schooling and in fact was falling behind on every subject, especially with his reading. I decided to do phonics with him, but Aiden had an emotional resistance to learning, so that resulted in ongoing tantrums, but he persevered and completed it successfully. What this has taught me is that when a child or a youth has a committed adult in their life that stands by them, they are enabled to reach their full potential and go beyond and above our wildest dreams.
Roberta Jameson is a Mohawk from the Six Nations of the Grand River Territory who has achieved many firsts in Canada. She was the first First Nation woman in Canada to earn a law degree, the first woman ombudsman of Ontario, and the first woman elected chief of the Six Nations of the Grand River Territory. As an Indigenous woman, Roberta knew she had a responsibility to work hard to create a better future for the seventh generation. As president and CEO of Inspire, Roberta firmly believes that education, role models, and mentorship are the keys to creating systemic change in Indigenous communities, and has received numerous honorary degrees and awards, including the Order of Canada.
A young First Nations girl told me that the support she received from Inspire was the first time in her life that someone believed in her. She felt validated as an Indigenous person and supported. She was then determined to achieve her potential and her dreams through education.
Dr. Jane Matheson has over 45 years of experience in human service organizations across government, nonprofit, and for-profit organizations. As a former CEO of Woods Homes, a nationally recognized children's mental health center, Jane committed herself to helping children and youth. It was a daily experience of learning something new. Throughout her career, Jane has been steadfast and uncompromising in her quest to improve the lives of children and youth impacted by trauma, disadvantaged by poverty, and marginalized purely by circumstance. She has persistently looked for interventions and treatments that are effective and evidence-based. Jane recognizes that measuring outcomes is crucial to figuring out what works.
Being committed to children really works. It helps people become contributing and strong human beings. And I suppose, unfortunately, one only finds this out after the fact, when young people who are now grown up call you up or take you out for a coffee and say, "Why did you never give up on me?"